Welcome to another informative episode of Health 360. Today, we are going to be exploring the vital connection between our minds, our bodies, and our everyday well-being. And today, we are taking a closer look at how the human brain and nervous system respond to stress and trauma. With our guest in the studio, Amira Sadik Abdullahi.
Thank you for having me. My name is Amira Sadik Abdullahi. I am a health educator, author, and a mental health advocate.
That makes you the right man for the job.
Thank you.
Okay, so Amira, how would you describe PTSD to somebody who has no knowledge of it beyond how movies portray it as something that only happens to actors that act like soldiers that have been to World War II or war front?
Okay, many people think PTSD, that is post-traumatic stress disorder, only happens to soldiers. That's what we also often see in movies. But PTSD can happen to anyone, regardless of age, profession, or gender. PTSD can happen to anyone who experience a shocking or life-threatening event. For example, those that experience sexual assault, survivors of domestic violence, natural disaster, those who grew up in unhealthy environments, and those that lost a loved one.
Okay.
Yeah.
To we, the layman, how would you explain what goes on in the brain of somebody who has PTSD? Like when they get triggered, what goes on in their brain?
Okay, PTSD makes the brain alarm system to be overactive. When the person gets triggers, the brain goes into survival mode. The heart starts racing, breathing becomes faster. This is because the body is following the brain signal. The brain is reacting to memory, but the body is reacting as if the traumatic event is happening at that moment. So that is why they feel unsafe even if they are in their comfort zone.
Okay, so we've seen in movies and heard and research shows that sounds can trigger things. Even a scent, a sound, or even noise can just trigger people's PTSD. How does that work?
Yes, triggers are ordinary things. A particular smell, a loud noise, a voice, a place, or even a certain date can actually have effect on someone with PTSD, because ordinary things have extraordinary effect on some people with PTSD, and the triggers might last for just few seconds or moments, but the person will spend the entire day trying to recover emotionally, or even days.
That's a lot.
Yeah,
we think PTSD are like all those big things when they're cowering and they're shivering and they're kept on edge all day. But what are those sneaky signs that we do not see that is so obvious? There's like people not being able to sleep, or people having issues with certain things. Some people can just see something and you don't even know they've seen it, but they'll just be uncomfortable.
Yes.
What are those signs?
Many people don't realize how PTSD affects the whole body. Sometimes trauma doesn't have to announce itself. It appears as constant overthinking. They will start having insomnia, that is difficulty in sleeping. It even weakens the immune system. They have poor concentration, and then they also have digestion problem. And they are also emotionally drained. This is because their nervous system is always in survival mode, so it affects a person as a whole. Yeah, that's
okay.
It.
So during my research, I figured that PTSD patient, not me figuring, but like my research, PTSD patients have, or victims rather, have problems with being relaxed. Like they don't like being relaxed. They're always on the edge, like something is always going to happen. Can you explain that to us?
Okay, this may sound strange, but being calm or relaxed with people with PTSD is actually unfamiliar. This is because after the traumatic event, the brain always feels like the danger will happen at any moment, and which makes it difficult for them to relax. And it's not like people with PTSD don't want to relax. It's just that their brain is trained to protect them. Even when they begin to relax, the brain feels like they're becoming vulnerable. So at that moment, it is difficult for them to relax.
Okay. Some people see some things and they just shut down, or they hear some things and they just shut down. You said that before.
Yes.
So how can they begin to feel again after they've gone numb? I would like for you to elaborate due to your background in medicine as a medical personnel.
Okay. Emotional numbness is actually the brain's strategy brain survival strategy, or should I say survival response to trauma. Many people think trauma is about feeling sad, panicking, having anxiety, but at times trauma feels like nothing at all. This is the brain's way of saying this pain is too much for me, I need to shut down for now. But with time, when the person experiences safety, comfort, and connection, they begin to heal emotionally. So at some point, they will stop feeling joy, sadness, happiness, at times even love. So when they experience this love, connection, and safety, their emotions will begin to come back slowly.
Okay. With your experience as a medical personnel, I have to go back to that again.
Okay.
And Nigerians in general.
Okay.
Can you just tell us one or two things you've seen with PTSD patients, or you've experienced personally, or we Nigerians are currently doing? We don't even know we have PTSD, but then we do have PTSD.
Yes. There is this.
Let's have that little discussion.
Okay, there is this thing Nigerians usually say, I am fine. How are you? I am fine. So not knowing that they are not okay, they are using this word, I am fine, like as their coping strategy. Knowing that deep down they are experiencing pain. Other people don't even know that they are experiencing pain. So I know you have also experienced this. How are you? I am fine. At times, some people feel nothing at all. They won't feel empathy. They won't feel sympathy. So this is also part of post-traumatic stress disorder.
This I am fine quote.
Yes.
I think I was reading something online one day, and this Nigerian came up and was like, whenever he asks his Russian friends, how are you? They are always like, what, do you really want to know how I am?
I'm fine.
But then it's a Nigerian thing, you just expect them to say they are fine.
Yes.
Okay, so one in how many Nigerians actually have PTSD?
I can say that like about 50% of Nigerians, because a lot lost their loved ones. A lot Nigerian experiences natural disaster. Example, this recent flood in Maiduguri, and people being kidnapped by bandits. So they will be traumatized. This is the trending episode of trauma.
And how do you even think we are responding to that as persons? Because personally, I don't think we have enough therapists in Nigeria to be like, oh, this person has PTSD, send them to a therapy.
And then one thing, therapy is actually expensive in Nigeria. And then a lot don't even realize that they need therapy session, because there is this layman language, like Nigerians usually think therapy is actually for mad people, just like the word mental health is actually for mad people. So a lot don't even realize that they are going through PTSD.
I would have to say this. Some Nigerian parents don't even believe in any mental health issue. Like, what do you mean you are depressed? You are not depressed.
Yes, our African mothers most especially.
So what do you think we should do better?
I think people should pay attention to their mental health, and they should know that it is okay not to be okay. Personally, I've been traumatized because when I schooled in Maiduguri, that is Borno State, so there is this insurgency, there's suicide bombers everywhere, and there is bomb blasts everywhere. So it actually traumatized me to the extent that any loud sound, I will react to it, and I'm still traumatized up till now.
And lots of people are actually traumatized because up till today, there's still bomb blasts in Borno, and lots of people live with that. And
people also are being kidnapped.
And children.
Yes, and a lot also live in an unhealthy environment, so it often traumatizes them, most especially kids. That's why children usually grow up with childhood trauma.
Okay, so if you want to know somebody's a PTSD patient, what are the signs you should look into? Like, this person has PTSD, these are the signs I should look into.
Okay, sometimes they will be overthinking, and there will be fear of uncertain situations, and one of the major signs are withdrawal. They withdraw from people, yes.
But like the withdrawal thing, it is a thing with many Nigerians. We withdraw a lot. You are talking to somebody, all of a sudden you think you're good, and the next thing, they're gone.
Yes. Actually, people with PTSD usually feel alone, unsafe, and for some people, they even feel unwanted. So that's why they prefer staying alone. And then, we Nigerians, whenever I come to you with my problems, we end up judging, or we end up gossiping about it. So that's why many people prefer keeping their problems
To
to themselves. Yeah.
It's the thing, you tell somebody you have this problem and the next thing they are
Yes,
like laughing.
it will be the topic of discussion.
Or gossip.
Yes.
And PTSD can even happen for many things. Okay, I should direct this question to you as the personal here. Do you think PTSD can happen from many things beyond what we just mentioned? I mean, we have mentioned war, we have mentioned
sexual
abuse,
assault,
we have mentioned accident and
like I said, trauma
one.
is any shocking or traumatic event. Actually, any event that will affect how you cope with life, it's actually trauma. Yeah.
Have you had any personal experience with somebody?
Even students experience trauma.
Exam trauma.
Yeah. Even students, for example, low grades can traumatize them. Not able to meet up with grades actually traumatize students.
I mean, what would you go back home to tell your parents?
Yes, and also like our youths now being in labor market for long, searching for a job because you meet someone, a graduate for 10 years will be searching for a job. Actually, that is traumatizing.
The traumatizing events. I mean, and again, a lot of people are traumatized because they
even divorce.
Divorce can be traumatizing.
Yes,
too.
Yes, can be traumatizing.
That is a lot. We are going on a short break and we will be back shortly. Welcome back from that break, and if you have been watching, this has been Health 360 and we've been discussing post-traumatic stress disorder with my guests
Amira Sadik Abdullahi.
Okay, thank you, Amira. Okay, so let's get to our next question.
Okay.
You were saying something about how people who think they have gotten over PTSD and boom, 1 2 years later it just happens again.
Yes, absolutely. PTSD doesn't have an expiry date. Many people honestly believe that they have moved on, but later on they will start having flashbacks, nightmares, even eating disorder, emotional numbness, withdrawal, and panic attacks. This happens because the brain is still responding to the traumatic event. So for example, maybe someone got traumatized because of the death of a loved one. So whenever he or she sees experiences another death, so it will start afresh. So honestly, they will be like, I'm fine now, I've experienced this before, so I think I can get over this. But it doesn't happen like that because it have to do with the nervous system.
The trauma is like an ongoing thing. It's
yes,
not like
yes.
For instance,
since we don't have control over our nerves, so it's an ongoing thing.
We actually do not have control over our nerves?
Yes.
I mean, and it's like a thing where sometimes some people have been hurt by knives or anything and they just get triggered.
Yes, personally, I developed phobia for a sharp object, not even like anything sharp object. Now, whenever I'm cutting something, I usually get triggered, like because I was a victim when I undergot surgery. I entered into the theater room with my legs, so I saw all the knives spread on the table. So since then, I feel like I will be slaughtered. So I feel like since then, I developed phobia for sharp object. Now, if I even have a cut here, just a percent.
Okay.
Yeah.
So, for our viewers watching, what are those tiny things you think if somebody spirals or goes into depression, what are those things you think they can do to help the person? All those tiny things.
Okay. Whenever someone feels overwhelmed, the first thing they should do is slow breathing. Like they should breathe in and breathe out. Whenever they are panting, their brain and their heart will feel like they are in danger. But whenever they slow their breathing, like breathe in, breathe out, their brain will know that they are out of danger. And they should take a short walk, meditate, or even surround themselves with someone that makes them feel safe. So it will make their body back to normal.
You said something about meditation. Can you elaborate on that? What is that?
Meditating actually is you will just sit in a relaxed position, maybe close your eyes and calm your nerves.
Okay, that's quite easy.
Yes, you should just stay calm, close your eyes, get a good posture, and that's all.
Okay, so with your experience in the medical field, how do you think Nigerians combat PTSD? How do you think they approach it?
Actually, some people are actually dramatic about it. the way they approach PTSD, because a lot don't even know what PTSD is. They will say that like it's something new to them. So at times it will be like just a mood switch. So that's how they see PTSD. Because someone now, you'll be talking to him after being traumatized, like the person will overreact. Or at times the person will just show you, how are you? I'm fine, and that's all.
And in the mood you're like, oh, this person is very rude, or this person is sassy. You don't actually know what they are going through.
Yes.
Or all those kids we used to say, oh, you have too much mood swing.
Yes. So childhood trauma is becoming rampant now, and a lot of parents don't even realize that.
Can you elaborate on that?
Some children are having withdrawal syndrome, and a lot of parents think it's just normal, or it's just their character or personality.
And even anorexia.
Yes.
Some children don't eat, and you just think, oh, it's because you're spoiled.
And then
that's
you
why
know
you're not
some
eating.
kids don't speak up.
Okay, they say healing happens in a relationship. How does having a supportive friend, partner, or community help someone recover from trauma?
Actually, relationships doesn't erase trauma, but they make healing easier. For example, now people that are traumatized, they feel unwanted, unsafe, and even unsupported. But a healthy friend, a healthy relationship, having a friend, a partner, or a community will make them feel that they are not alone. And when they feel the sense of safety, they will begin to recover. And having a social connection isn't just comforting, it is the best therapy. Some people actually are human medicine. When you spend time with them, you feel okay, much better.
Okay.
So like, it is better to have social connections, have a friend you trust, and then people you enjoy their company. It's actually one of the best therapy.
Speaking of human medicines, this brings me to people that stay around toxic people.
Yeah.
Toxic people. Can we please talk about them more?
But at least, one thing I'm sure of, at least you will find one person that you are safe with.
You will find one person you're safe with. And some people just think, oh, I don't need anybody. Nobody needs anybody. They can be an island.
Yes, because we are being judgmental. We humans, we are being judgmental. So that's why people feel that way. But actually, like I said, some people are human medicine. You spend time with them, and problem shared is
a problem solved.
Yeah. So the moment you share your problem with someone you trust, you will feel a bit lighter.
You will feel lighter, but people don't even care about that.
Yes.
Because then they don't want to
We need to be less judgmental, and then we should stop gossiping about people's problems.
It's none of our business. We should stay off of it.
It is good to mind your business as well.
So, beyond PTSD, are there other form of trauma that people actually experience?
Yes, trauma and PTSD are different things. Some people will be traumatized, but some people don't have PTSD. It doesn't have post reaction. So trauma is different from post-traumatic stress disorder. Some people will get traumatized and they will just move on, while some people get triggers, lots of episodes of triggers.
So just because I'm traumatized does not mean I have PTSD.
Yes.
Okay, so people with PTSD are always having flashbacks. What does that look like for them?
Actually, they feel like that traumatic event, whenever they have the flashback, they feel like that traumatic event is happening at that moment, because their brain is still processing what happened. And as I told you earlier, the body follows the brain signal. So they will feel like that traumatic event is happening at that moment. That's why they react. For some people, they will start sweating, having racing heart.
I have to take you back to something you said earlier.
Okay.
You mentioned some kids having withdrawal syndromes.
Yes.
Why do you think kids are developing withdrawal syndromes nowadays, and what do you think the effect is going to look like in the next 10 years?
Yes, they will have withdrawal syndromes. They will not be able to associate with people, and at times it goes into personality disorder. Associating with people will be difficult for them. That's why some people even develop stage fright. And then parents need to pay attention to their children. For some people that grew up in unhealthy environment, like I said, victims of survivors of domestic violence, so these children will be traumatized, and for some people they have trust issues because they don't relate with people, and relating with people they will find it very difficult. So it might develop to personality disorder.
Personality disorder. Yeah. Okay, that is true. And let me even add, let me chip in something quickly.
Okay.
You know, some people have avoidance detachment style.
Yes.
And we don't even know it is it's a form of PTSD.
Yes.
Once you are getting too close to them like this, they just want to zoom off because then you are knowing too much and anything can happen.
Because they enjoy their own company. They are used to staying alone, so they enjoy their own company.
Okay, so you know, PTSD has different formats and people express their PTSD in different ways.
Yes.
But then, Nigerian parents, or let me use guardians, some Nigerian parents or guardians will just see it as you are battling a spiritual issue. How can we address that?
Yes. It's not everything that is spiritual, most especially African parents, or should I say African mothers. They can be dramatic when it comes to these kind of beliefs, but not everything is spiritual. With some therapy and some normal exercises and normal healthy habits, they can overcome that. It's not everything that is spiritual, and I will highly recommend therapy, even though therapy is very expensive in Nigeria, or they should go for counseling, or they should meet a health educator.
How would you know you can trust your therapist?
Yeah, because therapy is confidential. Therapy is confidential.
Do we have like an association or something that's like
because it's against their certificates, their profession as well.
Did they study that in school?
Yes. There is a course called psychotherapy.
Okay.
And they go series of classes and lectures, so they have their license.
Okay. Okay, now we've spoken about how the parents can help the child, but then how can we help the parents identify PTSD, and how can we educate them that it doesn't mean your child is battling a spiritual problem, but this and this, your actions, maybe you and your spouse are always shouting, it is affecting the child.
Yes. Parents need to pay attention to their children, most especially when they get triggered. They should notice what triggers them, and they should pay attention when the child is having withdrawal symptoms. That is and they should also listen to the child. That's why I love seeing the bond between parents and children, because some don't even know what their children are going through. Some don't even care to ask how their children are doing. It's not, they don't care how they are doing physically, emotionally, or psychologically. As far as they are not in the hospital and they are not lying down, they will just believe that their children are fine.
I mean, it is a thing. We mentioned that some students have PTSD from exams, fear of not meeting up with my GPA.
Yes.
Most Nigerian, sorry to say, but like most Nigerian parents don't care about your mental health. They don't even see it as a thing.
Yes.
Like, is mental health skinny? Is it even a thing?
Actually, me personally, I developed trauma when I was in school, because most of my friends are studying medical courses and they are looking at my course as a very useless course, if I would say, because I studied health education, and they will be like, where are you going to work? And it actually traumatized me, because I was having this anxiety, like, okay, what next? But they will be fine.
You were having a where am I going to work?
Yes, I'm having this anxiety, like, what will the future hold?
What would I do in school? What would I do after school?
I'm not even proud to say my course at that moment. So it actually traumatized me. I get triggered whenever someone asks me, what course are you studying? I get triggered, like, I'll be like, okay, health education. I'm not even proud of it. So I know a lot are going through this as well.
Not to even divert, but social media is aiding a lot of these things, because tell me why you'll be scrolling through social media and you'll be saying, what is the most useless course in Nigeria?
Yes.
And somebody will tell you, mass comm, fishery.
Yes. And then, we often compare our lives to other people, and actually it can be traumatizing. We have different journeys, so we shouldn't compare ourselves with others.
Okay.
As well.
So does PTSD have a sign? Like, you look at this person and know, this person has PTSD.
Yeah, it has a sign. Like I said, emotional numbness.
Emotional numbness.
They feel nothing at all.
But then, some people have PTSD, but you would not know until they spiral.
Yes.
Okay, that is a thing.
Yes.
Okay, so children can definitely have PTSD too. We have spoken about that. And PTSD never really goes away.
Yes, it doesn't have an expiry date.
Okay, I'd like for you to still talk about that more.
Yeah, it doesn't have an expiry date because you think that you have honestly moved on, but after years, months, or days, and then you get triggered and you start having the nightmares, the panic attack, the anxieties.
Okay, so if a friend or if somebody has a friend or a family that is suffering PTSD, how do you think they can help them?
The first thing they should do is listen without judgment, and they should avoid saying you'll be fine or why don't you just move on. At times your presence matters. Your presence is more powerful than your words. When someone feels safe with you, like they can trust you with that, and it will fasten the healing process for them.
So how do you think the government can come in and help, since 50% of Nigerians are battling PTSD?
Yes.
How do you think they can step in and help us?
I think they should make therapy, like, though therapy is a private thing, but I think the government can also hire therapists as in the hospital, because I have seen in the hospital a lot are not going through something physically. For example, HIV patients, they will have it in mind that, okay, I'm going to die, I'm going to die, I'm going to die. But with counseling and therapy, they will be fine.
At the end of the day, I think counseling are only for, let me say, students that lost their parent or somebody that has HIV, like you said.
Anyone.
So they should make counseling compulsory.
Not really compulsory, but affordable.
Affordable.
Yeah.
Okay, so you mentioned something about Maiduguri and how the bomb blast has impacted you and it has made you develop PTSD for sound.
Yes.
For loud sounds,
yes.
Instead. How do you think, if the government want to focus on that region in particular, how do you think they can help? And do you think the people are even open to accepting that kind of help? I mean, you want me to go and divulge my secret to somebody I do not know in the name of a therapist?
Yes. I think they should help us, we the Nigerians, with security, because if this continues happening, even when someone goes into therapy, like they will continue having the flashbacks, series of attack can develop more trauma. So they should help us with the security. From the security side, they should work on it. And also, people should learn to trust. Like when you open up to someone, problem shared is half solved. Yeah.
Beyond the government, NGOs can step in.
Yes.
If an NGO wants to step in today, what is the first aspect you would want them to tackle?
I think domestic violence and sexual assault, because I have seen a lot of ladies react to harmless touch. Yes, they should focus on, though they are tried now, but a lot are going through a lot. A lot of ladies are going through a lot, and domestic violence as well.
Okay, so a final word to wrap things up.
Okay.
What is one thing you would say to somebody that has PTSD now, or a family member who has a family that is dealing with PTSD, or a friend who knows a friend that is dealing with PTSD?
Okay, to anyone who feels stuck in the past, I need you to know that healing is possible. Right now, you feel like the pain is not going to end, but how you feel today is not how you feel forever. And you shouldn't compare your healing journey to anyone. We all heal differently, and how you feel today is not how you feel tomorrow. Some days old memories come back, and some days you'll be fine. And this chapter you're in right now is not the end of your story, and it is okay not to be okay.
Thank you so much for that piece of advice, Amira, and it was so encouraging, actually.
Thank you for having me. I hope you also achieve a good mental health.
Amen. Thank you. Thank you for tuning into this episode of Health 360. Remember that taking care of your mental and physical health is an ongoing journey that requires patience, understanding, and compassion. Whether you're supporting a friend or navigating your own path, knowledge and collection are two powerful tools for growth. And until next time, take good care of yourselves. This has been Health 360, and I'm your host, Onyie Shukra.